The primary image on the left is a coronal view, which slices the brain from front to back. The smaller panels on the right provide additional perspectives: a sagittal view, side profile, an axial view, top-down, and a 3D volume surface reconstruction showing the external anatomy of the brain. According to the metadata at the bottom, this is a T1 weighted sequence performed with gadolinium, a contrast agent. In T1 weighted images with contrast, highly vascularized areas or regions with a breakdown in the blood-brain barrier appear bright, hyperintense. Key anatomical observations: the lesion. In the center of the coronal, sagittal, and axial views, there is a prominent, well-defined, bright circular area. This represents an enhancing lesion located in the cellar and suprasellar region, which is the area surrounding the pituitary gland at the base of the brain ventricular system. Above the lesion, the lateral ventricles, fluid-filled cavities, are visible. Their symmetrical shape suggests that, at this level, there is no significant midline shift or secondary hydrocephalus, fluid buildup, caused by the mass point 3D reconstruction. The bottom right panel shows a computer-generated model of the brain surface, highlighting the gyri, ridges, and sulci, grooves. This view is often used for surgical planning to understand the lesion's depth relative to the surface. Potential differential diagnoses: the appearance of a well-circumscribed, enhancing mass in the cellar region in a 17-year-old female, as noted in the patient info, could be consistent with several possibilities. Pituitary adenoma, a common, typically benign tumor of the pituitary gland itself. Craniopharyngioma, a tumor derived from embryonic tissue, often occurring in children and young adults. Near the pituitary stalk. Rathke's cleft cyst, a fluid-filled sac that can sometimes show peripheral enhancement on a contrast MRI. Clinical considerations: the location of this finding is critical because it is near the optic chiasm, where the optic nerves cross. Pressure from a mass in this area can lead to visual field deficits. Clinical management typically involves a combination of neurological exams, hormone level testing, and consultation with a neurosurgeon or endocrinologist. Subscribe the channel. Thank you so much for the end.